Welcome, my brilliant providers. I'm going to be sharing the stories of some of the patients that left their mark over the years. I would love to hear your stories too, the patients that really stood out to you, the cases that you remember, and the ones that you made an impact in their life. Maybe you helped them in a way that was really big for them. So, do be sharing those stories. Today, I'm going to a couple of things that I noticed as I was in healthcare for the 20 years that I was there. But also, I want to talk about how that influences how I teach now, how I help you make your dream practice inevitable. For those of you that don't know me, I'm Marinda Nelson. I help healthcare providers go from bored and burned out to truly doing what they love. As healthcare providers, you're a human that gets to help other humans. At the root of this, that's what we do. It's this impact that you bring. It's this caring and compassionate resource that you get to be on your patient's healthcare journey. And so it is about the patients for us. It's about you doing what you love, but it is about the impact and the influence for the patient. In my shorter videos this week, I'll be telling stories about specific patients. But today, I want to talk about these themes. And there are two that I want to speak about today. And then we will talk about kind of what this taught me about practicing in healthcare, and then how I share that with you and how that's informed how I help you make your dream practice inevitable, and how I can say that, yes, you can have that fun and fulfilling practice that you want to have. It gets to be authentic and it gets to be prosperous and profitable. And there's a way that this works together where I can commit to that and I can guarantee that that is possible, even though that what you're being taught elsewhere says that that's not true. So the first category that I want to talk about, the thank you notes that I got from patients and the gratitude that I got from patients and their family. One of the core concepts that I teach and that I share with you all, and that I drive home over and over and over, that might be different than what you've been taught, is respecting your patients as empowered decision makers, remembering that you are a resource on their healthcare journey. This is their healthcare journey. They are coming to you for information, for testing, for advice, for recommendations, but ultimately it is their healthcare journey. They're coming to you with their fears and their worries and their dreams and their desires and the beliefs that they have and the stories that they've heard, and pairing the resources that you have available together with what their dreams and desires are is your role as a healthcare provider. It's not your job to save them. It's not your job to make their healthcare journey look the way that somebody else says that it should. Your job is to be a resource for them. So many of these thank yous that I had over the years were for taking the time to explain what was happening in their body, to listen to those dreams and desires that they had, to truly show up and pause. There was one thing that could be better about this pair of contacts. If there was one symptom that's driving the most crazy with your Parkinson's, if there's one hobby or passion that you would love to be able to do with less dependence on aids, what that might that be? These targeted open-ended questions and then a pause allows your patient to tell you what they're truly trying to achieve. We're not just trying to get their labs to match within normal limits. We're not just trying to find a contact lens that fits. You are a resource for their healthcare journey. So, listening to and giving them space to share not just what they think they should, but actually what they're experiencing and actually what their dreams and desires are. Meaning, and then taking the time to explain what's happening in their body. how much gratitude I've gotten for taking the time, for slowing down and being able to explain in ways and words that they can understand what's happening in their body and realizing that they don't know and making comparisons and helping them with visuals. These are things that we know to do and kind of forget sometimes to do. And then once I have heard them, mm, taking what they say and then educating them on the resources that are available, not making a decision for them. This is their healthcare journey, but letting them know what's available. Hey, I heard you say this. I'm not so sure about that one. I heard you say that this is a priority. Not so sure about that one. These are kind of the two that I would narrow it down for you. What do you think? And then allowing them to choose. This is going to minimize confusion and misunderstandings. This is going to minimize so many of those follow-ups where they didn't do the thing, where they didn't understand the directions. This gets rid of so many of the messages or those follow-ups that are super low coding or non-charge coding, the emails and the frustrated phone calls where they have chosen the thing. This is also going to increase your conversion rates, your compliance rates, your referral rates with patients referring their family and friends because that appointment, that way that they feel then in that appointment is something that they're going to refer their friends and their family to. And then these get to be appointments that you get to code higher. So taking that extra 30 seconds on the front end, I get it. Your schedules are slammed and it is hard because you don't see the outcome right away, right? Because you're not going to see those referrals that so and so referred because you're scheduled out a number of weeks or a number of months, right, for a new patient to come in. You may not see those right away when the patients start referring their families and friends. You may not see it because your reporting comes out at the beginning of the month or Q2 or, once the insurance pays, and that can be, 6 months out. And so sometimes we don't see the results of what we're doing right away, but starting it now, not delaying any longer, but simply knowing in your heart that this is going to benefit everyone in the long run. And patients appreciate this. Practicing this way makes your dream practice inevitable. I have proven it over and over and over in practices where I worked, but then also with providers that I've worked with since I've returned back to healthcare time and time and time again. Taking this time on the front end and having that core belief, that core value, that core understanding that your patients are empowered decision makers and that you are a resource on their healthcare journey changes um, that victor victim, that savior needing to be saved, that better than you dynamic that comes so often between a provider and a patient that can lead to misunderstandings and to unsatisfied, unhappy, both the patients and the providers, as well as the staff. And this really can make it more fun and more fulfilling, but also more profitable. The other category that I wanted to speak to is the countless lives saved. And this is noticing patterns. So there's 3 categories that I wanna talk about this one in, and one of them is as you have these conversations with patients, you're going to hear the symptoms that maybe they don't think to speak to right away, or maybe they think they don't matter, but those are the ones that are gonna trigger you to look a little deeper. And so it's the patient that says that they've been having some confusion lately, that they've been feeling a little out of breath. And it's not maybe when they're talking about their initial symptoms, but they say it along with another statement that they make and noticing those little things, having that awareness, that's one of the pieces of mastery of leadership that we speak to is this awareness piece, having this awareness in your patient exams. Yes, for what they say, but also for what they allude to, and also for what they're not saying. Oh, yeah, I quit dancing. Well, why did you quit dancing? Does your toe hurt? Are you out of breath? Do you get tired in the evenings? Right, and then hearing that and then asking those follow-up targeted questions, okay? So that was one, is truly listening and having that awareness to your patient. The next, it was the pre-ops or looking at other medical records from other providers and synthesizing that information. And so really looking at that, not just is it within normal limits, but has there been a weight gain, a weight loss? Has there been less comfort in this? Is that number maybe still in the normal range, but on their labs, but it continues to decrease? Maybe their weight's been gradually decreasing and they're not trying. Are they losing muscle mass? Are they not able to get around as easily? Looking not just at normal ranges, but actually checking the patterns and actually looking at these things for the patients. Now, I know that your time is so limited to review a pre-op or review a referred provider's medical records or notes or review other providers' information. But this is a place that you can catch so many things that other providers aren't seeing, and this makes them really dedicated to you. This helps this be really fun and fulfilling for you. Again, this can lead to higher coding, higher patient satisfaction scores, higher outcome scores. And then this also is going to contribute to your higher referral rates. This is also going to then lead to your prosperous and profitable practice. Then this last one is simply catching patterns. So I spoke of this awareness piece. So being aware to what your patient's saying, what they're alluding to, and to what they're not saying. Also noticing the patterns and trends in their medical records or their medical history. This is noticing patterns and trends with among your patients. So I had a number of patients with just kind of a persistent dry cough for a number of months. They may talk about having been on antibiotics for the cold. They may have talked about starting an inhaler for this cough, allergies. They each had kind of a different story about it, but I recognized it as the same cough. And then I recognized that each of them were on a similar medication. And so, while it wasn't in my scope of practice to ask about that, it was a conversation that I had with them about having a conversation with the prescriber of that medication. There were alternatives in that category, that medication category. And when patients were changed to a different medication, then that cough that had been driving them crazy went away. So it was huge thank yous for things like this. There was one patient who I worked in eye care, many of you know, for many years, and a daughter came in and said, "Hey, my mom says that she can't see, but then she can notice that I left a paper clip over here. What's that?" Explaining that macular degeneration is central vision and glaucoma can be the peripheral vision, but that she still has pieces of vision that are available. So while she can't look ahead straight at you, while she maybe can't read, that might be in a part of her vision that she can see kind of over there. And taking the time to hear those questions, to answer those questions, to help them understand those questions, again, is going to lead to better understanding, better buy in, more compliance with treatment recommendations, with referrals, with better understanding. So, less unnecessary follow ups and higher room for more complex coding type appointments. The stress for you can go down as the provider and for your staff. And then your billing can actually go up. It gets to be more fun. It gets to be more fulfilling this way. You get to have authentic conversations with patients, and it gets to be more prosperous and more profitable. Practicing this way is possible. Your dream practice is not only possible, but when you practice this way, It's inevitable. So stick around this week, press the follow, press the subscribe buttons, whichever platform you're on. And I'm going to be telling you more specific patient stories and how that applies to what you're doing in your practice and how that can help you go from bored and burned out to making your dream practice inevitable so that you get to do what you love. We'll see you soon.